I'm a transplant surgeon here at Rush. I've been at Rush since 2012, and I'm the director of the pancreas transplant program, and I also head the research unit. The people that come to see us typically come because their kidneys may be about to fail. Very few know about pancreas transplant when they come in, but when we see them and we see that they're diabetic on insulin and need a kidney and a pancreas, we discuss with them. So I let them know you could potentially benefiting from getting a kidney and a pancreas. When I do a pancreas transplant, believe it or not, in the operating room, blood sugar comes down the moment the pancreas reperfused when we put the blood back into it. The first time I saw a kidney that was pale, putting a new person pink and making urine, just was all I needed. And since then, every time I do a transplant, just seeing them walk, seeing the kidney make urine, see the patients getting off dialysis, seeing how excited and happy the patient makes my day all the time. The gratitude you see on their face is just unbelievable. It's as if I have multiple kidneys that I keep giving and giving and giving. I just love it.